Dr. Levitt explains the different types of hysterectomy surgeries and how far the surgery has evolved. For most patients, Dr. Levitt prescribes the laparoscopic single-site robotic hysterectomy due to its minimal invasiveness and shorter recovery time. Your specific needs will be addressed at your pre-op consultation, where the best options for you will be presented.
Hysterectomy is often asked about, and there are 8 different ways to do a hysterectomy. The old days, we'd cut people open like a C-section, take out their uterus that way. When I was in residency, we did 5 of those a day. Now I do one of those every 1 or 2 years. It's pretty rare that we would do that anymore. Usually we do something like an abdominal hysterectomy for a uterus that's really big, or fibroid tumors, or someone who has a lot of scarring or adhesions, previous surgery in the past. They went to supracervical hysterectomy abdominally after that, back in the 60s and 70s, thinking that would spare sexual function and be better for orgasm for patients. But they did a study in the 70s on 20,000 patients that showed it didn't make a difference if you took or left the cervix. Then they started trying to get away from a 2 to 5 day hospital stay by doing vaginal hysterectomy. You cut in vaginally around the uterus and pull it down and out from the vagina. The downside to it that I see is, number one, it's a little bit of a blind procedure. You're clamping and cutting things you don't see well. You may have your bowel stuck to your uterus, but you can't see it. And you can injure your bowel, bladder, ureters by doing that surgery. The second thing I don't love about a vaginal hysterectomy is that you pull your ovaries down and sew them close to the top of the vagina. And when you do that, then you bang into them with intercourse, and they can also cause pain. Tell guys, if you pull your testicles down and sew it to your leg and hold it like that the rest of your life, that might be one of the things you might feel with a vaginal hysterectomy. So I tell people, not my favorite, but they went to another surgery called a laparoscopic assisted vaginal hysterectomy, where they put little pokes in the belly, blow the patient full of air so you can see, and do the dissection from above where you can clearly see what you're doing. The last part of it is the only part that's blind, where they cut in from the vaginal side and take the uterus out from below, but that leaves your ovaries up where they're supposed to be. Then they went to total laparoscopic hysterectomy. When I was in training, we were doing total laparoscopic hysterectomy, looking from above, cutting all the way into the vagina instead of doing anything vaginally. You still remove the uterus from below, but close the vagina from the inside. We were trained that way, but some doctors were not, and so it makes it more difficult for them to do a laparoscopic hysterectomy. We went on to laparoscopic supracervical hysterectomy, thinking maybe that cervix did make a difference for some patients. There were some small studies of 30 to 50 people that said maybe it does make a difference. So we started doing laparoscopic supracervical hysterectomies, cutting the uterus off the cervix and using a thing called a morcellator to cut up and remove the uterus from the patient. Unfortunately, they had a patient back east who had fibroid tumors, which are common, and when they cut it up and took it out, they found out in pathology that the fibroids were a leiomyosarcoma, or a cancer of the uterus. And so they put out a big moratorium. They stopped laparoscopic supracervical hysterectomies from happening to make sure that we weren't spreading cancer in patients. To my knowledge, the patients never had recurrent cancer. Then we went on to total laparoscopic hysterectomy with a robot, which a lot of people are doing now. You have an incision in your belly button, 2 on the left and 1 or 2 on the right, depending on the surgeon. I usually use 4 incisions if we're doing a robotic hysterectomy, and a lot of people use 5. The nice thing about that is it makes a laparoscopic hysterectomy much easier for the surgeon. We have 2 cameras instead of 1, so it actually gives you depth perception instead of guessing how far something is away from the camera. So you are much more precise. The instruments also have wrists. So instead of a long stick that's 2 feet long that either grabs or cuts and turns, that's all the laparoscopic instruments do. These have wrists that you can turn inside the patient like this. So the ends of the instruments actually act like your hands. So you sit at a console over here and do surgery on a TV screen. The robot, which looks like a big spider over here, does the surgery for you. But you're controlling the surgery, of course. Then I went on to another surgery called a laparoscopic single-site robotic hysterectomy. So instead of 4 or 5 incisions, I just use 1, about this big, through your belly button. It's a lot better pain control. About 50% of people feel good enough to go home the same day. You have 3 or 4 less scars, depending on who would be doing that surgery. And as far as I know, I'm the only person in the Pacific Northwest doing those surgeries. We've done over 600 of those surgeries now. Our patients do great. Little tiny incisions, they're happy, they heal well, and they're quicker back to normal than other patients. So that's up for hysterectomies.